All right, so let's talk a little bit about the female reproductive cycle. So I like this chart because it ties together what is occurring as far as the hormone concentrations of luteinizing hormone, follicle stimulating hormone, with what's going on in the ovary. So overlaying it with, again, hormone levels of estrogen and progesterone, and then what is going on with the endometrial lining of the uterus. So all of these are lining up. So you'll notice there's day basically 0 here at the very leftmost edge, going all the way up to 27, and then back to day 1, day 2. And again, these are all lining up with one another. So let's kind of talk this through. So you'll notice here at day 0, someone decided that day 0, you got to start somewhere, is the first day that bleeding occurs, right, during menses. So that's day 0, and not surprisingly, the endometrial lining, as we're losing it, it becomes much thinner, right? And that's actually what the bleeding is that's happening, right? We're losing the lining, and so blood vessels are also rupturing, so there's a loss of both tissue as well as blood because of that. Okay, so during that time, we have luteinizing hormone and follicle stimulating hormone. You'll notice that those levels are kind of keeping in line with one another, although there's this increase in follicle stimulating hormone, and that increase in follicle stimulating hormone is going to stimulate the development of follicles, as the name would suggest. So we go from a primordial follicle to primary to secondary, and then they start to mature. Along with this follicle stimulating hormone and this ever-increasing follicle, it will release more and more estrogen levels, which then in turn will also cause the release of more and more luteinizing hormone. So you'll kind of notice the timing here. There's a peak in estrogen levels just right before there's this real peak in luteinizing hormone levels, and just after there's this massive peak in luteinizing hormone levels, that is what triggers ovulation. So it is this peak in luteinizing hormone levels that will trigger ovulation. Okay, as I mentioned to you before, like, so this oocyte will float off into the fallopian tubes, and these follicular cells that stay behind form this corpus luteum, and this luteinizing hormone will help maintain that corpus luteum. This corpus luteum will then secrete progesterone, and you'll notice there's an increase in these progesterone levels, and that progesterone is what is maintaining this thickened endometrial lining. Now that is important because if this egg that has been ovulated here is fertilized in the fallopian tubes, it takes a few days before it makes its way to the endometrium, and it can embed itself into the endometrial lining for the embryo to begin to develop. Now, if that does happen, there is a feedback mechanism that maintains this corpus luteum until a proper placenta can be formed, in which case that will take over the maintenance of the endometrial lining. However, if that does not happen, if there's no fertilized egg, then that feedback loop there's no further feedback being given to the corpus luteum. Again, as it degrades, those progesterone levels are going to drop, and as those progesterone levels drop, basically that prevents the maintenance of the uterine lining any longer, and it is released. So all that stratum functionalis of the endometrial lining is released, and again, that breaks blood vessels, which causes the bleeding to occur. Okay, so hopefully that makes sense. So follicle stimulating hormone stimulates the follicle. That causes an increase in estrogen levels. It's this peak in estrogen levels that causes a peak in luteinizing hormone levels. It's going to be that peak in luteinizing hormone levels that causes ovulation to occur. It's going to be the maintenance of this corpus luteum that will cause high levels of progesterone. Those high levels of progesterone maintain the uterine lining. As soon as that corpus luteum begins to degrade, those progesterone levels drop, and similarly the uterine lining is shed, and then the cycle just starts all over again. And that's simply what this slide is showing you. And just as a reminder of a term, this body that remains after ovulation occurs is called the corpus hemorrhagicum. This is what is left behind, and this is what's left behind, and this corpus hemorrhagicum is what will turn into the corpus luteum. Some women notice when they ovulate, it's not as obvious to everybody. So there's increase in basal body temperature, there's changes in cervical mucus, the cervix will also soften. This is, you may or may not notice this, but this is so that sperm can again get across. And then there's something called Mittelschmerz, which is pain. So some women can actually feel the pain of ovulation. Not everyone, though. Menopause is part of the natural cycle, so things that women get to look forward to. Menopause is defined as, a woman is defined as being in menopause when they have undergone 12 consecutive months without a menstrual period. There are 3 main stages of that. There's perimenopause, so this is where there might be some inconsistent or decline in the menstrual cycle. Then there's true menopause, where there's now been 12 consecutive months without a menstrual period, and then postmenopause, which is then, month 13, I guess, of not having a menstrual period. Oh, so many lovely symptoms to look forward to: hot flashes, night sweats, vaginal dryness, urinary urgency, difficulty sleeping, emotional changes. Look at the change in these hormones. Look at that. You go from like this baseline to, what is that, 1, 2, maybe 3 times the levels. And then you stop having these regular kind of cyclical events. That's going to take a toll on the body. So just be aware that menopause has come with all of these symptoms. Obviously, women, as you get older, make sure you're talking to your doctor and find a good one that truly understands menopause, please. Okay. Hopefully you guys understood all that. If you have any questions, please let me know. And then the next thing that we'll talk about is what can go wrong in the female reproductive system.